My name is Donna Mason. I am a pediatric nurse at UCLA Mattel Children's Hospital in Westwood, California. My responsibilities are a little different because I work a night shift. So we count on the day shift to pass on information that the nutritionist has discussed with the pediatric team and the nurses in regards to the patients. So I don't do a one-on-one with the nutritionist, but we do work as a team. We have patients that are dependent by G-tube or NG that are short-term and long-term patients. So we have different types of nutrition needs that are met through different types of enteral feeds, and then we also have patients that have TPN dependency along with a G-tube or NG regimen. Sometimes their gut isn't working, so their G-tube gets placed to gravity so that gets drained, but their nutrition goes through their J-tube. So one could be open while one is being used. It's kind of a interesting concept. One is open to a gravity drainage bag, so that if they have extra acid production or extra gastric juices being made, it goes out into a bag so that it doesn't make them upset and it doesn't give them abdominal pain, while their tube feedings are going past their stomach through a different tube and going into their intestines, and that's where they have their nutrition absorbed. So yeah, nutrition does play a specific role in a lot of our transplant patients. We have kidney transplants, we have liver transplants, we have heart transplants, and each one plays a specific role. And probably the liver transplants are the most complicated because they have the intestines and the gut to take into consideration. We also have seizure patients that we do a diet-based plan to try and help their seizures. It's called the ketogenic diet, and it can work for a certain amount of patients, and it will do well. I've seen it work for a certain amount of time, and then the seizures unfortunately come back. So it is a trial basis, but it has worked for a lot of people, a lot of kids. We do have a diabetic coordinator that works with the nutritionist for our type 1 diabetes. We have a lot of kids that come in at different ages, and it is a combination education for the family, the siblings, the parents. Everybody has to understand what's going on. So it's a little challenging because the kids don't understand why they're being poked and why we're testing their blood sugars, or why they can't eat what they want to eat. And so it's a big family type community education. Yes, because pediatric patients don't really understand why they can't have a certain thing or why they're not eating the same as their siblings. I think adults, they're easier to explain that need. Kids just don't understand why they can't eat something, or why if they eat something it makes their stomach hurt, or if they eat something it makes them throw up. So it's a little bit different to explain that to them. So a lot of times the kids that are in the hospital are they don't always feel sick, but they have things that they're hooked up to constantly. Either they're hooked up to their parental nutrition, their TPN, their lipids. It runs either from anywhere from 12 hours, sometimes 18, 22, sometimes continuously. They also have their feeds that are hooked up to a G-tube generally, or a G-tube or a J-tube that they're hooked up to. Sometimes they only have 1 or 2 hours that they're disconnected to from during the day so that they can play. But sometimes they just go with their pump. So they're connected, their pump just goes with them. They're connected to an IV pole, and they just know. They sometimes they just stand on the pole, and we scoot the pole with them to the playroom. Sometimes they carry their own pole. Sometimes they're in a wagon, and the pole goes behind them. It's just whatever they can do to make them feel normal.